Hello everyone and welcome grade 12 Health Sciences. درسنا مع بعض يا شباب الميديكال terminology اللي هي المصطلحات الطبية، وعرفنا what is medical terminology، وعرفنا ان medical terminology is the language used by healthcare professionals who speak English, and we'll study what is the importance of medical terminology, and studied medical prefix, suffix, root word, and the common vowel, and studied medical reports. Now we will study responding to medical instruction. Responding to medical instruction. Learning objectives. By the end of this lesson, learners will have completed a common medical terms activity and the matching exercise, a visit the doctor quiz, activity practicing responding to medical terminology. Starter activity. Can you think of any times when you might need to understand and respond to medical instruction? What is respond mean? Respond mean to say or write something as an answer to question or request. Responding اللي هي الاستجابة. To say إن أنت تقول حاجة أو تكتب حاجة. To say or write something as answer to question or request. Medical instructions. If you become a healthcare professional, you will need to respond to medical instruction daily. There are times when you might need to understand and respond to medical instruction. Such time include during a medical emergency, when visiting your doctor, during a first aid situation. Firstly, during a medical emergency, you might be given direction from a medical professional over the phone. Your doctor might use medical terms when you are talking to them. During a medical emergency, you might be given direction الاتجاهات from a medical professional over the phone بواسطة التليفون. Your doctor might use الدكتور ممكن يستخدم medical terms اللي هي المصطلحات الطبية when you are talking to them لما يحب إن هو يتكلم أو يتحدث معك. Knowing some medical terms that are commonly used will help you in these and other medical situations. لما انت تتعلم المصطلحات الطبية دي او المصطلحات الشائعة، تمام، used will help you انها بتساعدك in these and other medical situations، بتساعدك في المواقف الطبية المختلفة. Now we will study common medical terms. Knowing some common medical terms will help you in these and other medical situations. Acute meaning an illness lasts for short time less than 3 months. عبارة عن مرض مدته قصيرة بيستمر لمدة 3 شهور أو أقل. Chronic a disease or illness lasts 3 months or more. الكورنيك عبارة عن مرض بيستمر لمدة 3 شهور أو أكتر. ما أجي أقول لك what is the difference between acute and chronic. Acute short time, chronic long time. Acute like less than 3 months like coronavirus أو COVID-19. Chronic a disease or illness lasts 3 months or more. Okay. Contiguous meaning having a sickness that can be passed to someone else by touching. Cure meaning something such as drug or medical treatment that stops a disease and makes someone healthy again. Diagnosis mean this is when a medical professional identifies the disease or illness that patient has. Infectious mean a disease that can be spread to other people by germs. Common medical term like prognosis, a doctor's opinion about how someone will recover from an illness or injury. يعني الدكتور بيقول رأيه في إن في شخص مثلا will recover، يعني أخذ اللي هو بنقول عليه recover from an illness or injury، استشفاء من المرض أو من الجراحة. Remission Remission when the symptoms of the patient disease get better but are not cured. Sign and symptom is very important. Sign, evidence of illness that can be seen by others, such as a skin rash or a cough. Symptoms, a feeling or physical change experienced by a patient, such as pain. Terminal, having an illness that cannot be cured. Treatment, something that deals with disease or injury to make someone feel better or become healthy again. Remission when the symptoms اللي هي الأعراض أو العلامات of the patient اللي بتظهر على المريض get better but are not cured بيتحسن بس لكن هو ما بيتعالجوش but are not cured. sign اللي هي الحاجات اللي انت بتشوفها زي السكين راش اللي هو الطفح الجلدي أو القف اللي هو الكحة. symptoms اللي هو شيء أنا بشعر بيه a feeling or physical change experienced by patient such as pain اللي هو الألم. terminal, having an illness that cannot be cured عبارة عن مرض لا يتم شفاؤه. treatment اللي هو العلاج something that deals with disease or injury to make someone feel better or become healthy again ان الشخص من بعد ما ياخد العلاج ده بيحس ان هو بقى كويس صحته كويسة وبقى تمام. match the following sentences. infectious meaning a disease that can be spread to other people by grams. chronic a disease or illness lasts 3 months or more. remission when the symptoms of the patient disease gets better but are not cured. terminal, having an illness that cannot be cured. prognosis, a doctor's opinion about how someone will recover from an illness or injury. diagnosis, this is when a medical professional identifies the disease or illness that a patient has. contiguous, having a sickness that can be passed to someone else by touching. Okay. visiting the doctor. قبل ما تروح للدكتور بتاخد موعد. الموعد ده اللي هو appointment. What is appointment? Appointment is an arrangement to meet with someone at particular place and time. يعني انت بتروح لشخص في مكان محدد وقت محدد. تمام؟ وانت رايح لمين؟ للدكتور. When you visit the doctor, you should prepare for the appointment. This includes being able to understand the medical terms so that you can communicate with your doctor. بقول لك لما تحب تروح للدكتور you should prepare for the appointment. لازم تحضر للموعد اللي انت هتروح للدكتور فيه. This includes being able to ده بيساعدك ان انت تفهم understand medical terms اللي هي المصطلحات الطبية so that you can communicate with your doctor وده بيساعدك ان انت تتواصل مع الدكتور. عندي في قبل ما تروح للدكتور عندي before the appointment, during the appointment, after the appointment. Before the appointment or before you meet the doctor, think about what is the reason for the visit. ايه هو سبب زيارتي للدكتور. Making a list of the things that you want to talk to your doctor about so that you don't forget anything. حاول تجيب قائمة وتكتب فيها الأشياء اللي انت بتعاني منها وتقولها كلها للدكتور وحاول ان انت ما تنساش منها أي شيء. During the appointment أثناء الموعد. When you see the doctor لما تشوف الدكتور describe the sign and symptom of the condition in much detail as possible. حاول ان انت تقول كل الأعراض والعلامات للحالة اللي موجودة عندك بكل تفاصيلها إن أمكن. Tell your doctor about your medical history. هتخبر الدكتور عن التاريخ الطبي الخاص بك. Tell your doctor what parts of your body are affected. حاول تقول للدكتور ايه هي الأجزاء اللي مؤثرة عليك أو الأجزاء اللي هي بتوجعك في جسمك. If you don't understand what the doctor is saying, ask them to explain it. لو انت ما فهمتش الدكتور قال ايه اسأله ان هو يوضح لك تاني. Make notes of any test and medication the doctor recommended. حاول ان انت تكتب كل او تجيب نوت كده وتكتب فيها التست اللي الدكتور طلبه and medication الادوية اللي الدكتور طلبها that doctor recommend او الادوية اللي الدكتور وصى عليها انك تجيبها. After the appointment, when you leave the medical center, ask yourself. لما تغادر الميديكال سنتر، المكان اللي انت كنت فيه عند الدكتور، حاول تسأل نفسك بعض الأسئلة. Did you get your question answered؟ هل ان انت توصلت للأسئلة اللي الدكتور سألك عنها؟ Did you cover all of your signs and symptoms؟ هل انت غطيت كل الأعراض والعلامات اللي ظهرت على الحالة بتاعتك؟ Do you know what you should do now؟ What medication to take؟ انت عارف ايه الدواء اللي انت هتاخده؟ What test you need؟ عارف ايه هو التست او التشيك اللي انت هتروح تعمله عند الدكتور؟ What specialized to see؟ If you have any question, call to speak to the doctor again. لو عندك اي اسئلة كلم الدكتور مرة ثانية. Medical emergency. How you communicate with medical professional at emergency situation is very important. They might give you instruction about how to help the person who is sick or injured. How you communicate with medical professional، ازاي ان انت تتواصل مع medical professional في حالة الطوارئ او في الموقف الطارئ، ده حاجة مهمة جدا. They might give you instruction، هيديك بعض التعليمات about how to help the person، ازاي ان انت تساعد الشخص who is sick or injured، ازاي تساعد الشخص اللي هو مريض او حدث له حادث او انجرح. Something to remember، عندي أشياء لازم تتذكرها. أول حاجة stay calm، خليك هادي. You will be able to help more if you don't panic. لو انت متوتر مش هتعرف تعمل أي حاجة، مش هتعرف تساعده. Explain what is happening as clearly as possible. Include any sign and symptoms، حاول توضح أو تقول اللي حدث بالظبط، وتقول إيه هي الأعراض والعلامات اللي انت شفتها. Listen carefully to the instruction that the medical professional give you. You might be an instructor to give a first aid. If you don't understand what you are being instructed to do, ask the medical professional to explain it more clearly. Remember, you should give first aid if you are qualified and instructed to do so by a medical professional. ينبغي عليك ان انت ما تعملش الاسعافات الاوليه لحد الا اذا كنت مؤهل او عندك تعليمات من الميديكال بروفيشنالز. clear. Parts of exam. Question 1. A patient has been diagnosed with an illness that cannot be cured. Cannot be cured. What type of illness is this? Who can answer? Prognosis, terminal, infectious, acute. Your answer is terminal. الأسئلة اللي بعد كده هتجاوب عليها في التعليقات وهنتظر منك الإجابة. تمام؟ Question 2. A doctor thinks that their patient will recover on their own without the help of medication. Which of the following medical terms refer to a doctor's opinion about patient recovery? Remission, cure, diagnosis, prognosis. السؤال ده جه في امتحان السنة اللي فاتت. Question 3. Chronic means جه برضو في امتحان 2020. Chronic mean an illness of short duration, a disease or illness that lasts 3 months or more. None of the above، ماهوش موجود في الاختيارات اللي فوق. acute، أفكرك بس بالفرق بين الأكيوت والكورنيك. الأكيوت short time، أما الكورنيك هو long time. تمام. Question 4. Acute means an illness of short duration, a disease or condition that explains a person's symptoms, a break in a bone can be complete or incomplete. نفرق كويس بين الأكيوت والكرونيك، نفرق كويس بين الساين والسيمتومز، مهمين جدا جدا ومبسيبوش امتحان. Thank you all of you. كده نكون انتهينا من الدرس الرابع اللي هو الميديكال instructions.